Hi, I'm Stephanie and I'm from the ADHD Advocate. Welcome to week 4 of our LinkedIn Lives for this October ADHD Empowerment Month. And this week we are going to be looking at family and friends. So navigating family and friends with ADHD. And today we're talking about preparing for parenthood. And we've got Dr. Kara Davey here, who will be doing this webinar basically with us. It's going to be a bit longer than our usual lives. We've got slides this time, but yeah, very important for those that are looking to start a family with ADHD. You definitely want to listen to this. So Kara, welcome.
Thanks, Steph. Really appreciate the invite on. Is it helpful if I just say very briefly, just very brief intro? So as you said, my name is Kara Davey. I'm a clinical psychologist. I specialised in helping with people with infertility and baby loss, but also in the area of ADHD. So both of those are my kind of specialist areas, and helping people transition back to work. So something I'm really passionate about. Thank you.
Yeah, and we're both parents of children with ADHD, so we're not just speaking from a professional perspective. We very much have the personal experience, which is very much ongoing, as they say, new level, new devil, in terms of as the kids grow up. So yeah, it's great that you're joining us. So yeah, I think we're going to first start off with you, Kara. You're going to talk about some of the issues with ADHD is trying to conceive and being able to deal with some of the losses.
Absolutely. So yeah, first of all, just to acknowledge that we know that the journey to conceiving isn't always easy for people. And as I say, that's kind of one of the areas I kind of specialize in. And we know that when people experience kind of grief through baby loss, or the kind of grief around the fertility journey being more difficult than it is should be usually, those kind of things, grief and trauma, they exacerbate our executive dysfunction, they exacerbate our emotional dysregulations, they make it harder even from the start, in addition to everything else that we get alongside kind of having ADHD and trying to go into that kind of parenting journey. So some of the things we identified as kind of extremely important for people with ADHD is that they tend to be more sensitive to rejection or failure. So if you're experiencing a more challenging fertility journey or you've experienced loss, suddenly that might be perceived as I failed, there's something wrong with me. And again, this kind of adds to that kind of the kind of increased distress that we get that comes alongside RSD and emotional dysregulation. So that might make it even more difficult for people. There's also a lot when you're trying to conceive, people often feel very helpless. The kind of lack of control really triggers stress and anxiety. And again, kind of alongside that, maybe the kind of rejection sensitivity. What is it about me? What's wrong with me? And also alongside that, just to say that with that rejection sensitivity, often people might feel that why is it me and not friends, or why are friends not supporting me kind of in this journey? And again, that can trigger the kind of RSD. And just moving on to kind of the impact on empathic partners. So what we know about people with ADHD is they tend to have very high levels of empathy themselves, be kind of hyper empathic, and often they will be attracted to partners who are also either ADHD or, maybe autistic, or a combination of those. So tend to be more attracted to also kind of somebody else who is neurodiverse. And again, that partner might struggle with, if they're neurodiverse, they might struggle with empathy, or they might again be hyper empathic. So you've got a kind of a household who are trying to deal with difficult life events and increased empathy, but also increased kind of emotional dysregulation. That can be kind of a boiling pot for things being quite difficult. And, when you've got a highly empathic partner who's watching their partner go through difficult fertility journey, loss, they're experiencing it themselves, but they're also seeing the distress in their partner. That can really add to the strain on the relationship, because both people are trying to cope with that. It's hard, and they might be coping in different ways that are really kind of triggering each other. So this is kind of right at the start, before even kind of going on to kind of the parenting journey itself. Okay, so then we've got pregnancy. So what we might notice in people with ADHD is that they are more sensitive to hormonal fluctuation. So again, those hormonal fluctuations, people with ADHD tend to more often experience PMDD and, kind of struggles with their hormones on a monthly basis anyway. This causes emotional dysregulation and cognitive difficulties. So when you go into pregnancy and your hormones are all over the place, there's much more of a difficulty with, you know, kind of managing that dysregulation and the kind of hormonal impact for people with ADHD on the whole. People with ADHD also tend to experience more sensory sensitivities and more of a kind of physical sensory experience to pain. So that could be either way. It could be that people experience pain more strongly and it feels, you know, kind of even more difficult to tolerate than for people without ADHD, or it can be the other way where they've got a really high pain threshold and actually they don't realize that there's a problem as a result of that, or it gets misinterpreted. When we come to birth, we'll talk about that more, but it can be misinterpreted because people are coping well, that actually they must not be experiencing the challenges they are, and it can, you know, that can become very invalidating. So those sensory experiences, as I say, might be increased discomfort. It might be they've got hypermobility, which causes more difficulties. It might increase pelvic girdle pain and fatigue kind of challenges. So that's common for people with ADHD. Also, for those who have ADHD and are medicated, actually this might be a time where kind of psychiatrists or professionals involved might recommend a change in medication, a reduction in medication. Again, might be on medications for mental health as well, and actually changing medications, or fear around what is the impact if I don't change my medication and I realize I really need to stay on this medication but I'm pregnant, and the kind of guilt or worries that might kind of bring. So medication is another kind of layer for people who, you know, who are medicated as a result of their ADHD. And then we move to more that kind of executive functioning. So we know people with ADHD struggle with executive functioning, but this can cause real decision paralysis. This kind of, do I need to deal with this problem right now or not? A lot of people go, it's overwhelming, it's too much, I can't quite do it because of those executive struggles, so I'll think about it later. So sometimes you find that people are then really struggling with planning and organization in their pregnancy because the overwhelm just means, oh, I can't think about it now. And suddenly they get to the end of the pregnancy and like, oh, I haven't really thought about anything because I just couldn't quite do it. It all felt kind of too in the future. And that's especially prominent if you have someone who goes into early labor, for example, or, you know, for people who have losses where they, you know, end up giving birth before the end of their pregnancy. They might not be completely unprepared because they've just not been able to kind of think about that, you know, as a result of that decision paralysis. We might also notice that there's increased worry and kind of what if scenarios. So that increased anxiety and emotional dysregulation that we see with ADHD can cause kind of people to catastrophize or have like a negativity bias, like what if I can't cope? What if I experience postnatal depression? What if I have a child with ADHD? What if I can't manage those challenges? What if we as a couple, you know, aren't able to parent in the way that we'd like to? They might kind of run over and be much more sensitive to kind of those worries and anxieties and fears, which again kind of increase their experience of that. Steph, I'll let you speak on the kind of stress on relationships, if that's all right.
Yeah, and I was just going to say, in terms of personal experiences with this, you know, I didn't know I had ADHD when I became pregnant that first time. And actually, you know, I did suffer from what I thought was, you know, looked like postnatal depression. This was my third child, actually. But it turned out that I had ADHD. Like, it was at that time that I discovered, hang on, you know, it's not depression like they think it is, because I went back to work and actually the so-called depression that I felt, once I got back to work, that depression kind of lifted as quickly as it came on, because that was actually my ADHD. You know, I changed my situation, felt like I was achieving again, getting back to work. And, you know, I obviously felt a lot better. But there isn't a lot of awareness, as, you know, at this stage, you know, when you go to your NCT groups. I was in Australia, so I didn't have an NCT group. It's called something different. But definitely no one, you know, particularly then, was talking about neurodiversity. And as you said, as Kara points out, there is a massive stress on the relationship. And that obviously only gets worse. And we'll talk about the actual post-pregnancy part, you know, parenthood with ADHD. But there are massive amounts of stresses on both partners, obviously, because with ADHD, it may be that one partner isn't particularly kind of kid-oriented as well, another might be. But if they're both, that can pose a huge challenge. And the other thing is, obviously, if you've got ADHD yourself, which most parents, if their child has ADHD, chances are you and your partner have got ADHD, and there is that additional burden on the executive function. So you're already getting overwhelmed before the baby's coming. So that's something that we actually help with in coaching to kind of prepare for, trying to manage your own ADHD, trying to find tools and ways to emotionally regulate. Because as you'll see, the most important thing as a parent with ADHD is that ability to create space, to hold the space when you're trying to help your child work through their emotional meltdowns. So yeah, it's really quite huge stress placed on relationships when, you know, with pregnancy and having children with ADHD. So yeah.
Yeah, absolutely. Okay, so thinking about the birth itself then, so we've talked a little bit about kind of the sensory sensitivities and pain, and but just coming back to the birth process, so kind of more specifically, as I say, what I when I'm supporting people, I do a lot of birth trauma type work and kind of adjusting if people have had losses, you know, they might be processing their loss, and people tend to talk about the birth experience as a time when health professionals are often kind of, it feels like they lack attunement with them. So sometimes the birth experience can be really, really positive, but because of those sensory experiences, if it's not understood by the healthcare professionals, if they haven't got a good understanding of how neurodivergent kind of people experience pain or sensory, they might be unaware of the impact of having lots of health professionals in a room, having bright lights up, having kind of how you experience pain, or how those kind of sensory experiences are kind of during that birth process for you. And sometimes that causes a mismatch in attunement with healthcare professionals, where they are assuming that you will respond like most other women and be normal and kind of fit in with cultural expectations of birth. And the reality is your birth experience might be different and your experience might be different, which is really valid. But if that's not understood, it can be, you know, kind of really misunderstood. And for people with ADHD, they tend to, especially those who found out they have ADHD later in life, they tend to have had a lot of experiences of not feeling understood, not feeling heard, of society trying to change how they are or how they react or how they respond to things. So going into a vulnerable position of giving birth, you need to be able to communicate how you feel and other people to hear it. And actually that can be really hard for people to be able to, you know, kind of put that across. You might be experiencing it differently, so healthcare professionals might misunderstand that. Also, it might be hard for you to advocate for yourself, to you know, kind of communicate in a way that other people hear, because you've got so many experiences of people not hearing it. So what a lot of people with ADHD have done is learnt to mask. So I'm not going to tell people that, or I'm going to kind of keep it to myself, but that can cause kind of challenges sometimes in that birth process, where people, as I say, are, you know, health professionals aren't able to help them because there's this breakdown in communication from whichever side or both sides, where there's just a misunderstanding of how someone should be and what they are experiencing, and that can affect sometimes care in that kind of birth process. And then we've got the more kind of going over to the kind of anxiety and executive function kind of impacts again. So, you know, again, as we've said, often people have that kind of difficulty with emotional, you know, kind of emotional regulation with ADHD. So they might be feeling a real increased sense of anxiety about getting, you know, often people with ADHD want the perfect birth. They've probably gone into hyper-focus, reading about how birth should be, how it could be, how they want it to be, that kind of, they've got an ideal of it, and then suddenly you're presented with a really unknown situation. When will I go into labor? What will that feel like? Who will be there? Will they listen to me? You know, how long will it last? How will I feel afterwards? Like, there's a whole kind of host of things that we know that uncertainty causes anxiety. That's quite hard to tolerate and to regulate for anybody, but can be especially kind of difficult if you're kind of more emotionally dysregulated. And then people are trying to, often what people will do when they feel uncertain is try to grab hold of some sense of control, and, you know, kind of, I want to be able to control the situation. And again, birth is generally a process where it's quite, you know, there's a lack of control in a lot of that, like how that experience will go, how others will respond, you know, kind of how it will, you know, kind of feel. And that process in itself can be quite traumatizing, and not just the birth itself, but that lack of attunement from healthcare professionals. If people are saying to you, I remember when I had my third, you know, people were saying, well, she's not coming yet. I'm like, she is. I can feel her. Like I can feel her move. They're like, no, your contractions aren't long enough. And I was like, they are. Like, she's there. Like, and you know, and I remember saying, you know, can you just check? And they're like, no, we can tell you're not there yet. And I was like, well, can you check? And they're like, oh, she's there. I'm like, I know she's there. I've been telling you that. Like, I'm quite clear on that. Like, so, you know, it can be really hard to get people to kind of understand that, you know, kind of, and hear you, because they've got a sense of what you should look like or how that should be. But as I say, sometimes that can take the control away, because even when you are clearly communicating it, actually, if someone's not hearing it and they're not responding, then you're, you know, kind of powerless to that situation. And that in itself often causes birth trauma. We think of birth trauma as about harm to mum or baby, but sometimes actually it's that experience of being dismissed, invalidated, not heard. You know, those experiences are really what causes kind of birth trauma, and that's more likely to happen for people who are neurodivergent because of all of the, you know, the reasons we've just discussed. Okay, I'm not going to go into detail about this, but I just wanted to share there's been a recent paper looking at the experiences of people on the perinatal journey who are neurodivergent, and what services can do at each of the stages to improve some of these things that we're talking about. If anyone is interested, it's a really nice little map in terms of what are the extra bits that you might experience at each of the stage. This is antenatal, this is labour and birth, this is postnatal, so continuity of care, and it looks at what is it that you could do, or you could be speaking to professionals about, to kind of make some of those adaptations and changes. So if anyone's interested, let me know, and I'll send you the kind of link or a picture of that diagram, because I think it's a really nice way of what I don't want people to do is come away from this feeling like, oh my goodness, like it's hard enough and now these additional challenges are here because I've got ADHD. Yes, there are additional challenges, but I guess the reason we're talking about that is because what can we do to help and support you on that? And, you know, Steph and I are very passionate about helping with that, but also there's some things that, you know, you can look at and help to prepare yourself alongside kind of the things we're offering. So yeah, do let me know if you would like a copy of that. Okay. And then going into kind of parenthood itself, is there anything you wanted to add on that?
I think it's great. I think it's really good that there's more awareness of, you know, neurodiversity impact on that journey, because definitely when we were going through it, it wasn't there. And what I was thinking earlier, you're right, in terms of difficulties communicating, but from my perspective, it was more difficulties communicating your needs because of people pleasing. You know, I'm the type of ADHD, if I'm getting a massage and it's like really light and I'm not really getting out of it, anything much out of it, I just kind of don't, you know, usually I don't say anything. I've had to work my way to be bolder and can you please press harder? But you can imagine something like birth. But I guess when the pain's there, like with most ADHDers, you know, when if you're in pain and there's urgency, which there will be, I guess, given you're giving birth, we're able to, you know, move past this people pleasing stage, and the emotion speaks for us. And but again, it's much better for us to be able to speak up earlier than wait for it to be too late, you know, and that's why forewarned is forearmed. Being able to make sure you've got that right support beforehand, you're making the plan, the roadmap, you know, as much as you can control and roadmap, I guess, you know, to set yourself up for success, but knowing that there will be things that will out of your control that you're going to need to accept, make your peace with. So important, that part, isn't it, Kara?
Absolutely, yeah, I couldn't agree more. And yeah, all of the things you say kind of totally resonate. And I think there is you know, people pleasing is a really good point, because if you hold it in and you're trying to people please, which again, so many people, you know, especially those kind of late diagnosed will do, what will happen is it will probably burst out in a really unhelpful way when you've been trying to hold it in, and then it comes out that you're the difficult person or the one who's really angry, or, you know, and again, that's less conducive to the compassionate, supportive care that people want and need around, you know, kind of birth and labor. So, you know, if it comes out in the wrong way, suddenly that might be a kind of jarring in that relationship with professionals, which again means that your kind of birthing experience is kind of already set off on the wrong foot, rather than being able to kind of recognize what you might need and communicate that. But it's hard, so hard to do for people with ADHD.
Yeah, but again, looking at it maybe with that lens of, well, actually, rather than deferring the kind of inconvenience and maybe some, you know, frustration or whatever, much better to from the outset, talk about your needs, be upfront. Sure, there might be a little bit of inconvenience, but it's bound to be a lot less than if you leave it to the last minute, because then that is going to usually be much harder, right, for the healthcare professionals to address that need. So definitely, yeah.
Absolutely. And if you know that you're a people pleaser or someone who's going to find that difficult, I think it can be really helpful to try and have conversations with your partner in advance around like how can they advocate or support you at those times. If are they clear on what you want and need, so that if you don't feel able to say it for whatever reason, they can help you with that. And I often say to people, especially people who might have experienced loss and are going on for another pregnancy, for example, like your birth plan isn't just about what pain medication you might want, or that is also a chance to say what you need emotionally or sensory, or kind of all of these things we're identifying. If you're not going to be able to say it in the moment, or that might be challenging, write it down so that when the health professionals look at your birth plan, they can see, this is someone who has ADHD, this is something they notice about themselves. Get the health professionals to check in a bit more. Are you sure you're okay? You've let us know that you're someone who would always say you're okay, like how are you really? Or so sometimes you're going to hand that responsibility or delegate it a little bit to others as well. Like it's not just on you. You're in the middle of giving birth and it's a heightened experience. Don't think that also needs to be a time where you suddenly have to change your communication style. Maybe it's about thinking about how to scaffold or work around that if that's a challenge for you. Kind of naturally.
Completely right. Yeah, now's not the time, guys, to aim for that independence. Very much first interdependence. Really lean on as much support as you can get. It's the most difficult time of your life. Your health is at stake, in a major way. So we really want to be leaning into support and getting those needs communicated early, adjusting expectations, clearly and early. And if you can't do it for you, what I found with my clients in coaching, they're much better able to self-care when they're pregnant, because they can frame it as in, but if I don't stop, the baby, because they could never do it for themselves before. It's like, no, I've got to get this thing done. Okay, sure, I burn out. That's just me. I will recover. I'll take a couple of days, to get better. But when you're pregnant, there's someone that you have to be better for. You've got to rest, not for you, but for the baby. And I find that ADHDers are much better able to look after themselves when they're pregnant in some ways.
Yeah, absolutely. I think that's a really good point. Like it's about finding our motivation, isn't it? And some of us, executive function means that task initiation and getting motivated is really tough. But sometimes that motivation of it's not for me, it's for, my little one, means that that's a real shift when people can do those things. But as I say, some will, some won't. It depends how your ADHD affects you. So, but I agree with you about the importance of support. And where we were talking about, maybe you've got a healthcare professional involved in medication and kind of changing medication. Also, it's a really good time if you're kind of wanting to reduce medication or you're changing medication to think about, okay, what support might be really helpful now? Like again, in terms of that advocating, if you can't do it, is there a professional, or do you want a coach or therapist who's understands ADHD involved to be able to kind of help you with that? It's support is kind of key here. It's really important.
So I guess talking about now the transition into parenthood, yeah, it is particularly challenging. I know for me, for instance, with my first, and it depends, but sometimes neurodiverse children can be just generally more difficult, maybe have, certain issues with, I don't know all the terms. Kara, you'd be much more across this kind of thing than I am, but my first wouldn't stop crying. I was not ready. I was not ready for my first child. And, I got the shock of my life. And actually, one of my biggest coping strategies as an ADHD was sleep. So we had right from the bat, right? I couldn't sleep. My child would not stop crying. And so my strongest coping strategy for my ADHD was literally pulled from under me. And that's not good.
Absolutely. And this is so common, actually, that, whether it is sleep or, whether you are someone who exercises a lot, you can't exercise for 6 weeks after birth. Like that might be your, kind of way of coping. It might be that hyperfocus is great. You're interested in something, but actually suddenly you can't because your baby's needs are coming first. And I think you're right. So many, if you do have a child who goes on to have neurodiversity, you're not going to know in those early stages, of course. but it might be that they, as a result, have, they are more sensitive to their kind of their surroundings, all the things we've talked about with sensory sensitivities, emotional dysregulation. You might have a child whose temperament feels slightly more difficult. There might be, they're not the baby who you can just put down and, kind of go to a class and they fall asleep on the mat next to you like all the other people's babies. Like, it might be that actually it's a really hard time where you're working so much harder as a parent with all of those strategies pulled from under you, and you're like, why? What am I doing wrong? Why is it, and again, that RSD, is it me? Like, what am I doing wrong as a parent? Why is my child not settled? Or when actually it might just be this, it's hard to experience that. And if there is neurodivergence there for them, then, of course, that might be making it more difficult. But the double whammy together is a real challenge.
And that was what happened. That was my story, basically. Right from the word, like after, with the breastfeeding, I had difficulties. I think I told you this, Kara. And there was, a breastfeeding class in the hospital, where all the mothers could take their newborns, and Eva wouldn't latch, and she'd just cry and cry. And I was told to leave the class. So in terms of RSD, my first child, and no, out, you just should leave now. I just remember going, oh, it was awful. I cried. That was the beginning. And, unfortunately, and it's a long journey, and don't want to put anyone off obviously having children. My children are amazing. But it's not easy as a parent with neurodiversity, having children with neurodiversity, and the difficulties can start as early as that.
Yeah, absolutely. And I think you're right. Like, I said this to you before when we met privately about this stuff, but, I am really sad for you that you had that experience. So that's not okay. Why do people go to a feeding clinic? Because they're struggling with feeding. Like, to be asked to leave is just not okay. Like, a baby crying, well, yes, because they're trying to latch and they can't latch. Like, that's a difficult experience, but it's not a reason to ask someone to leave. Like, that's traumatic and goes back to all of the things we've talked about with the, RSD, with the powerlessness, with the, kind of all of those things. It plays into all of those struggles. And again, feeding is a really tough one from a sensory perspective. For a lot of people, it might be physically kind of difficult to get babies to latch. A lot of people don't realize how hard it can be to establish breastfeeding. But when it is then someone kind of touching you and, being so close and all on their terms, again, that can be really challenging for parents, especially if you are kind of hypersensitive to, kind of that feeding in itself is a challenge. And again, if that's not going well for you, or, it takes time to establish, which it does for many people, there might be this kind of comparison and, what is it about me, etc. So it's a really hard experience, which a lot of people just don't talk about, or kind of warn people in advance might happen.
Yeah, I had no idea. I just didn't expect any of it when it happened. It was like, I remember saying that it was like aliens had come and abducted me, and I was on this, what's going on? Luckily, my second, completely different experience, she came out and basically I didn't see her for like 10 hours. She just slept. So I was able to, and it was a C-section, a planned one for my second. So it was completely different experience the second time around. And actually, I enjoyed being in hospital because it was a break from, being at home with my first one too. So yeah, it can be very different, from child to child as well. But the first one was an eye opener for me.
Yeah, absolutely. And I felt the same. Like, I wasn't aware of just how challenging that would be. And, kind of very much, for me, hyperfocus is probably a strategy I've used quite a lot. I didn't realize how hard that would be to suddenly have, and exercise, like to suddenly have those taken away was really challenging. I mean, I've had 3 children. My middle child was stillborn, but my 2 children who are here, both of them had sleep apnea and, absolutely wouldn't be put down, quite dysregulated, struggled with sleep, like lots of, kind of those challenges. And again, wasn't quite prepared for, kind of how difficult that would be. But yeah, and again, as it says on the slides, what that leads to is increased stress, increased dysregulation. I mean, I don't know how many bank cards I lost in the first year. Like the executive challenge of not being able to sleep because my little ones wouldn't sleep. I was like, what is wrong with me? Like, it was like baby brain on steroids. Like, it wasn't a, it wasn't, and I didn't know I had ADHD at that point. I was like, why won't my brain work at all? And yes, of course, sleep deprivation causes that, but there was much more going on that I wasn't kind of aware of with that. So yeah, you've got the kind of increased stress, you've got the increased executive dysfunction, you've got the increased emotional dysregulation, and then in amongst that, again, we've talked before about the stress that can put on a relationship in terms of how understanding is your partner, how supportive are they, like, is this building up resentment? Is it a time where you're able to support and come together, or is it a time where you kind of pull apart, or kind of feel judged or told you should be different? For lots of people with babies who won't sleep, their partners might say, oh, you're being too gentle, like maybe you should let them cry out. You might then come into these challenges around different parenting styles, which can then cause again real trouble for a relationship, where people are trying to navigate very different styles and interpretations of what's going on and why, because they might not have any idea that there's neurodivergence even in the picture, so they're looking for other explanations of that.
Yeah, and that's why it's good as well to have the experts come in and be able to diverse, to eliminate some of that conflict, hopefully. Yeah, it's really, really tough. And also, if you're both neurodiverse as parents, it's so important that we create space to regulate. We need space, we need flow time, quiet time for sensory. I know for me, just even crying, for a lot of ADHDers, the noise, with noise sensitivity, the crying, just like, you go from 0 to, in terms of stress and anxiety, just the baby crying can cause a lot of overwhelm and anxiety.
Yeah, that's a really good point. Again, that's a sensory kind of thing. And, but also for a lot of people, if you did have a difficult or traumatic birth, a lot of people don't realize the impact of that traumatic birth. And, for the crying of your baby might be the first thing that you experienced in kind of birth after they were born. And actually there can be a kind of trauma response going on that people aren't aware of there. And for a lot of people who are diagnosed with kind of postnatal depression, when they're kind of transitioning into parenthood, pretty much every woman I have diagnosed with ADHD who've already had children has told me they've had postnatal depression. And when we've explored it, it's either been trauma from the experience or the kind of lack of understanding of that, or it's been the kind of overwhelm rather than depression. Kind of it's the hormones fluctuating, it's the overwhelm of trying to juggle it all, it's the feeling like everyone else has got it down but I'm not planning, or I'm the one who's forgotten the baby wipes, I can't plan and organize like other people, why am I the chaotic one? Or it's those kind of things that are playing into low mood that are very much ADHD related, rather than it's where a lot of people have felt like, what's wrong with me, I've become depressed, kind of again that RSD, people feeling like a failure, where it's like, actually no, you're just trying to juggle a lot of different experiences, and that's even harder for you. And so yeah, I think so many people are misdiagnosed because actually the real reason and the kind of core part of what's causing that low mood or that kind of distress is missed by people around them.
Definitely, yeah. And I know for as well, if you were a professional woman and you're used to achieving things, then you go from that to looking after, in neurodiverse in particular, a baby, just to get through the day. You can't actually, you don't really feel like you're achieving, you can't. You're always firefighting nonstop, and then it's on repeat. The next day it's the same, and you just don't feel like you're making progress. And for some ADHD women, in particular, that were high achievers, that can really, reduce the fuel they've got, because that kind of achieving the progress was a huge source of stimulation and interest. So that's another thing that can be difficult.
Absolutely. And we know for people with ADHD, being bored can be almost painful. Like people experience like it almost quite physically in their body. And, again, I think this can bring a lot of shame out for women with ADHD of, why is everyone else really enjoying their baby? And I'm like, oh, I'm bored, I want to do something else, I want to be on my phone, or like, why can't I be present in the way that other people can? Or why am I struggling with this monotony? Or why am I struggling with the isolation? If you're, kind of someone who really needs that kind of social contact, and that's the way that you've kind of managed it. So, suddenly there's this, there's another layer of how challenging that is.
Yeah, no, that's spot on. Yeah, that is spot on. The guilt and the shame, because like you said, we don't really have perspective. ADHD is the best of times. We lose perspective even if we gain it very quickly. So we don't take context into account. So we're still expecting the same high standards of ourselves, even when, anyone could see, what are you doing? There's no way you should be expecting to be able to do this thing or that thing. Doing really well just to be able to have the baby fed, changed. If you manage to have a bit of a nap or something, wow, that is success. That is successful day. It's do you see that as well, Kara? The expectation.
Yeah, absolutely. The expectations tend to be very unrealistic. And again, I think that comes with the masking and the perfectionism that a lot of people have learned to just manage generally in, school or work or, general everyday life. They then want to be perfect parents. And actually, as we've talked about, there's so many reasons why it's harder for you and for baby potentially to, even manage this journey, let alone try and manage it perfectly. And then, you go along to these, kind of NCT or the groups that you think will be this nice supportive place. And if you see all these people managing it well, the perfectionism, really brings out that shame of like, well, why are they doing it and I can't? Or, and if there are social challenges there, whether that's, for people with ADHD and kind of autism, or just general social challenges that can come alongside kind of ADHD, what you then might find is people are trying to find a network of people similar to them in a group, and they can't find it. And they're like, why? What is it about me? Then, NCT was supposed to be supportive, and yet they're meeting up without me, or they're, they seem to be having such a different experience that they've decided to meet because it's easier not for me to be there, or I don't feel like I fit in. Or so, suddenly then it brings up social difficulties, and again, might map right back to early trauma in terms of, going into that parenthood. Just to touch on trauma there, it can bring up your own trauma from, being a child in terms of kind of school, but even earlier than that, of being parented yourself. So for lots of people where they're trying to do things really differently for their child and be more kind of attuned and there and supportive of their child, suddenly they're reminded of, well, why did no one do this for me when I was younger? Or why did no one understand this? Or, so it can bring up your own trauma if you've had quite an invalidating, kind of upbringing. Suddenly it's a time where people's, kind of own childhood trauma can really come to the forefront and be triggered in so many ways by all of this.
Yeah. Now, obviously, we're not trying to say do not have children. And I can imagine from hearing what we're saying. No, we just want everyone to be able to clearly appreciate the challenges, and the thing is, the more you understand these, the more you learn how to address these, get the support that you need. Okay, parenting will become a lot easier. I won't say easy, but it's so rewarding. You talk to anyone. I sometimes feel with my own parenting experience, there are days where you just don't know how you get through the day. It does test you to your limit, but you would never do anything differently. You'd have these amazing children, these very gifted, very talented, very, they've got massive hearts. That they're amazing, these kids, and it's a privilege. It's a privilege to be their parent. But there's some hurdles that we work out how to jump first.
Yeah, absolutely. And I think just touching on that, like, absolutely, this webinar isn't, to cause distress or fear for anyone, like, especially if you're kind of already, pregnant or kind of trying to get pregnant, or this isn't to scare anyone. It's because I guess both you and I are really passionate. We didn't know that we had ADHD going into that parenting journey. And I think, what we know is the best way to get the right support or to change any of those challenges is, first of all, you need to know what the challenges are. They need to not be blind to you. If you have no idea these are coming, you can't possibly put things in place that will help or support you with that. So I think, it's really important that, what we're trying to do here is raise that awareness so that actually you can get the right support in and, kind of have a very different experience so that it's not so difficult for you.
That's it, Kara. I think what you've just said there, so you can have it, because we did it our way without having that knowledge. We're a much better place to be able to help others not go through that same thing. And so that's what we're trying to do here, is to show you how it can be difficult, what we went through a lot without support, and what would have made the difference. We want to be able to equip you with what we didn't have that will make all the difference.
Yeah, absolutely. Okay, and then just kind of as we kind of approach the end, then thinking about, so baby's here, we've done that kind of first year or whatever the point is at which you transition back to work. For some people, as you say, they transition back early because parenting is hard and because they need the stimulation and they need that kind of interest back, or but whatever point it is that you transition back to work, I guess it's important to highlight that it is a transition. Suddenly everything's changing again. So you've gone from trying to adapt to pregnancy and the kind of hormones, but adapting to the birth, adapting to baby being here, just started to get into a routine of what that looks like. Suddenly you're adding work into the equation, and that can be really, really tough. Like, you know, again, from an executive functioning point of view, you've now got to plan and organize and manage time, not just for, you know, whilst you're at work, but also fitting around, okay, dropping baby off wherever the childcare is, or planning or getting their food ready or their milk ready or whatever. There's so many more kind of things to think about. And there's a lot of illness that comes with a child starting in childcare, or you know, kind of those kind of settings. So you've got to, okay, I'm going back to work. What does that look like for me? But how do I also manage the days where suddenly the childcare isn't there anymore, or my child needs me? So there's, you know, executive functioning wise, that's big. But also just going back to the workplace, suddenly you've got to remember a job that you've not been thinking about because you've been trying to adjust to parenting. There might be different policies and procedures in place. There might be, you know, things might have changed. You've had somebody probably covering your job. They might have been doing things differently. They might have moved things around the office and suddenly you can't find them anymore, and you're kind of sent into a kind of spin in terms of how to do that. Like, it is a transition. Going back and trying to find that work-life balance is not going to be the same as you're not going back to how it was. You're now going back to how that is, and, you know, parenting in the mix, and that's a lot. So, you know, it's a big transition, and you know, and we've talked about that kind of perfectionism and masking and people pleasing. Again, I think that often comes when people are coming back to work. They then want to prove themselves. I can still be the same perfect, amazing employee that I was before maternity leave, even though I'm now leaving earlier and, you know, working less hours or whatever. It's just often not possible. Like, a lot of people do go through, we talked about those realistic expectations. A lot of people go through that process of, okay, I need, you know, they try to do it all and then realize that it's having an impact on my well-being, and then needing to adjust kind of expectations, especially in the transition, you know, in those kind of early stages. Yeah. Is there anything else you wanted to say on that? Just pause for a moment.
Yeah, it's really, I think the guilt as well, again, you know, leaving your child, going to work, again, it's very hard, you know, you can't be the mother you want to be, you can't be the worker you want to be. So there's this feeling that you're failing, you know, in every area. And again, like you said, Kara, it's because of those expectations that we're setting ourselves. You know, it's just no one can, in that situation, can be the perfect mother and perfect worker. It's not possible.
Yeah, absolutely. And, you know, and I think everybody feels like that, regardless of whether you're neurodivergent or not. Like, people do experience that kind of guilt when you're at work on your child, and guilt when you're with your child or the bit you're not doing at work. But again, it can be just heightened for people who experience more emotional dysregulation or more executive function challenges. So
and the RSD being key, because, you know, at work, if you're people, you know, you're saying yes to everything, but no, you really shouldn't be. You know, if you've got to get home, like you said, Kara, early, no, don't be saying yes to that thing. And I think that's where, yeah, we really struggle.
Yeah, and in terms of maternity cover, that kind of idea, are they better than me? Do the team prefer them to me? Or, you know, again, that RSD can come in if suddenly, you know, I've worked with a lot of people in corporate environments where they say, oh, we're going to keep your mat cover on as well, like we like both of you, and people are like, oh, so I'm not good enough anymore, or actually they prefer them and they can't sack me, so now we're having to both do it, or, you know, and just trying to job share. Like, the executive function in that is you know, just another challenge as well, if that is kind of what's decided. And it's not necessarily decided, you know, because you're not doing a good enough job, but when that is decided, yeah, that can be a real challenge.
I had to do that, and that was like ridiculously difficult. So hard, because what we hate most, ADHD, is the ones I coach in particular as well. It's so important that we kind of start from the beginning. We need to be able to see, you know, the picture, build it out kind of ourselves, or get our head around it ourselves. and I was working, I think 2 or 3 days a week, and my job share person was the other couple of days. And so I'd come in the middle, and all these days had happened, and you're just trying to get on top of it through notes, and it's so fragmented, you can't really see the picture. And then having to pick that up, and maybe the deal's completing, it just is so stressful. And maybe they didn't do it the way you would have done it, and that's caused it. Yeah, it's hard. It's so when these things, if a job share is presented, you want to make sure it's a person that perhaps has a similar kind of way of working, or to you, someone you really trust, someone that it will mean that you're not having to kind of compensate or do more of the work. Yeah, it's tricky, but these things.
Again, so just briefly on that point before we move on, I think even if you have those things in place, sometimes, again, awareness is the key. So when I came back from maternity leave, my job share was actually someone who is one of my best friends. We had really good, kind of a good relationship between each other. We'd really help each other. It was probably the ideal job share, and yet still it felt almost impossible because she wanted to organize things in a different way to I did, or and I didn't know I had ADHD then. Actually, if I'd have known these things are really important to me because of the ADHD, this is what I need in the workplace, if we could have had that conversation and I could have understood it, that would have been a lot easier, because I could have had that conversation with her. We had a really good relationship and good communication, but I didn't know why it was so hard to be able to communicate that and for her to hear it. So I think there's something about, you can do a kind of profile of, this is how I work, this is what I need. And, regardless of who your job share is, if they're open to that, and if your manager's open to that, that gives a really different experience. So again, there are things that can be put in place to kind of help with these challenges. It's just about knowing what they are.
Yeah. And that can be, that's what we do in coaching, in therapy, is giving you that space to get clear on what your needs are, and be able to set yourself up to succeed going forward in any given situation within the journey, right?
Exactly that. If people don't know it already, come and speak to us. We do this all the time. We can help you identify it and give you the strategies and the kind of structure to do that, if actually that's something that obviously doesn't come naturally because you've not done it before.
Yeah, no, I would definitely recommend it to any ADHD that's expecting, because the more you understand your own ADHD as well, and you understand what's coming up, and you're making plans, and you're getting the right people in the right places to support you, knowing that it is going to be hard, accepting that it's going to be difficult, and that you need and you deserve the best support possible. If you can't do it for you, frame it in terms of your child you're going to do it for, but just get that right support. So just in terms of the tips, again, we can't stress enough for you to lean on support. So interdependence, not independence. It is not a time to go solo on these things. Trust us both on this, professionally and personally. Do not go solo. Yeah, because as you said, Kara, it is a time that you do feel isolated. And why is this happening to me, or what's wrong with me? Or you walk away from the NCT group just worse than you did when you arrived even. And that's not how it should be. Yeah. So you find your people, find the right support. You should be feeling lifted when you walk away from that group. You should feel lifted. Prioritize self-care. Now, again, at the best of times, us ADHDers, without being pregnant, do not do this very well whatsoever. But as we were saying before, when you're pregnant, I mean, that's when I did my yoga. I did my pregnancy yoga. That's when we get the baby, the massage, all the things that you wouldn't ordinarily do for yourself when you're pregnant. No, I must do my baby yoga. I must do my stuff. Do it. Lean in. Get that support. And, as well, you need to make sure that after you have the baby, having some time to yourself, it's crucial, isn't it, Kara?
Yeah, absolutely. Again, that kind of perfectionism, people often want to do it all. I don't need any help. I don't need to ask anyone. I don't, kind of try and juggle it all. And that's really tough. Actually, the self-care is, you can be brilliant and do it all and still have rest and time for you. Or, I think, when people understand what they need and say, actually, it's really important that I have some space, even if it's just to have a nap, or, going back to the kind of social element, it might be you go to these groups and there is, 10 people there who don't make you feel good, and there's one or two who do. fine, connect with those, forget the others. You don't have to connect with the whole group. You don't have to meet with a group. If you just find one or two that are your people, that's fine. But yeah, I think sometimes being able to just lean into, okay, maybe I do need a bit of help, or maybe it's okay to open up or be a bit vulnerable and kind of share what the challenges are with the right people around me, so that you can get your needs met, is really, really important. And again, it's not something that especially people who are late diagnosed in ADHD have probably been very practiced in, but it's a really good time to start trying to do it, because it will really help in the longevity of kind of the parenting journey.
Yeah, and again, this is where the coaching helps, doesn't it? In terms of we can help, we can give you permission to do these things. A lot of ADHDers, that if they've had trouble with self-caring, and that's one of the goals we set for the week, actually they'll feel guilty if they don't stop and do something, because I told my coach, I said I was going to do this, and actually that's what gets and it's whatever will get you to do the thing that you need to do. That's the main thing, isn't it? That you take that space somehow.
Absolutely. Therapy and coaching can be a space where you work out what the strategies are, but also it holds you accountable to, okay, I've said I'm going to do it, I'm going to do it. And even just that coaching or therapy space is, kind of self-care space. It's a place to kind of pause and a place to realize that it's not you failing or doing it wrong, or it's totally normal and okay how you feel, and let's help you to kind of be able to manage and cope with that better, and not do it in such a self-critical way.
Yeah, and we also obviously help you identify, understand, accept your needs. You're going to have more needs. You're responsible for developing a whole new life, during the pregnancy, and then afterwards, obviously keeping that life alive and healthy. And so you do need more. And I think that's something ADHD is, again, with the people pleasing. We don't like to, ask for more help if we need it. We just feel, oh, I should be able to do this. I should not a time where we should be shooting all over ourselves. And
very true.
Therapy and coaching can help you massively there.
And also, we've talked about the challenges here because that's the focus, but ADHDers also can make such amazing parents because of that hyper focus, because of their ability to kind of really want to do the best for their child, and kind of that real strong sense of empathy. They can make such good parents. And I think sometimes when you're in that kind of coaching or therapy, people will see the things that you don't see. You're seeing what you can't do or what you're doing wrong. To have someone be able to reflect, that's amazing that you did that, and isn't that incredible, and that's brilliant. Or to have someone be able to show the positive aspects, and your ADHD is kind of supporting and helping you in the parenting journey, as well as all of these challenges and the ways it's tripping up. I think it's really important for getting a bit more kind of balance in terms of well-being.
Actually, that is absolutely key. I know for myself, even, when I do my therapy and I talk about how, maybe things are difficult, but then I speak about something that I've done for one of my kids in circumstances where it's been ridiculously difficult, and just putting that focus on that win, makes all the difference in terms of my narrative, because I've been beating myself up. So, because where focus goes, energy flows, right? So having that space, having the therapist be able to recognize that, it can make such a massive difference to the way you view yourself.
Yeah, absolutely. And I think you're right that whilst a lot of ADHDers struggle to advocate for themselves, they advocate so well for their children. Or if we're going later into that parenting journey, if you have a child who's not being well supportive in school, or is experiencing bullying, or there's any kind of challenges, you will be the parent who is absolutely validating and supportive in a way that kind of maybe you didn't experience yourself. But it makes you such a wonderful parent, and sometimes people don't realize kind of, or see all of those kind of strengths in themselves. So yeah, that's a really good point.
Yeah, that just gave me goosebumps, actually, because, I mean, it's sad that ADHDers, there's so many, they don't see how amazing they are, or what amazing mothers they are. The narrative is really quite brutal, when actually they give so much to their children. They love them so much, give so much. But yeah, again, it's that perspective's just not there, and the expectations are completely, and that affects your enjoyment as a parent. And this is time, these kids grow up really quickly. You don't want to waste this time beating yourself up. I know I don't.
Yeah, absolutely. Couldn't agree more. Yeah.
So how we can help, Kara, did you want to?
Yeah, so I guess as we've spoken a little bit, kind of as we've gone through, but both of us offer one-to-one ADHD coaching. If you are looking for a diagnosis, I also do kind of diagnostic kind of assessments, if that's helpful for people, with a medication pathway, if people are looking for that. And then I also provide therapy, whether that is trauma therapy for some of the kind of trauma that's coming up, like specific trauma therapy, or just generally adapted therapy kind of approaches. So yeah, coming to one of us for kind of coaching or therapy might be a really helpful kind of first step in supporting you at whatever point you're at, whether that is preparing for parenthood, whether it's trying, whether it's pregnancy, kind of all of the points we've talked about. It might be really helpful to get that kind of support in place. I think you do this too, Steph, but I also do maternity coaching and that transition back to work. Do you provide that support as well? Yeah. Yeah, absolutely. And again, on relationships, it might be thinking as a couple about, kind of how can you best support as you're going into parenthood. So we can offer kind of coaching and therapy. We also are in the process of putting together an online parent-to-be education course for people with ADHD. So to help you with all of the things we've talked about, identifying some of those challenges and, kind of how to put kind of support in place for that. So we have a online version, and then we also have a version that comes with 6 coaching sessions within that. So you'll meet within a group of people who are also expectant parents with ADHD going through that journey. So you have the support from Steph and I, but also the other people in the group. So you could either buy it as an online to watch at home or with that kind of additional support. Or we do kind of customized support where you come to us and say, what is it? I want help with this, and we can kind of tailor that. Yeah, is there anything you wanted to add to that, Steph?
No, just to encourage anyone that is expecting to get support, and the earlier you get it, the better, honestly. And I'm sure you have done this too, Kara, have coached quite a few couples that were expecting to a place where they were so much better able to navigate their way through the early kind of months of parenting in particular, because they had, they were forewarned. They had the strategies, the right mindset. Their relationship, their communication was a lot better as well. So they were much better prepared for parenting. And yeah, it's a completely different experience for them than it would have been if they hadn't have got that support. So very much encourage anyone that could do with support to reach out.
Yeah, absolutely. And when we were talking about the the impact on relationships, just to say those who are kind of better prepared and have done this kind of support before or in those early journeys of parenting, what happens is you don't get the build-up of resentment and anger. And for a lot of people, I'm couples therapy trained as well, and people might come, when their child's 6 or something, and they're full of anger, resentment, like they've got into kind of bad habits or conflicting kind of strategies, and it's really hard to go back and try to help and support with, or kind of take away all of that resentment and anger. Whereas actually for those who get the support early on, that ability to communicate and support each other along the way, because they've had the support to see the challenges and put things in place, means that the relationship is a better, more supportive place without all that kind of resentment and anger, which just makes it easier for kind of everyone as a family.
Yeah, again, like speaking personally, it is so important. It's so important. There is such much higher rate of divorce, family breakdowns with ADHD in particular. And relationships, families can be saved with this type of support. Understanding your ADHD, your partner's ADHD, your children's ADHD, because otherwise the environment can become quite hostile in some cases. No one understanding each other, someone's kind of coping strategy triggering someone else because no one understands what's going on, and no one's kind of accepting and helping each other meet each other's needs. There's got to be that lens. Everyone needs to be looking through that same lens. Otherwise it can turn out, unfortunately, in divorce, and that's not what we want. So we would love to help you. I do reach out. There's some kind of, we've tried to make it as accessible as possible because we understand how important this is. So do reach out for any kind of support.
Yeah, absolutely.
Kara, thank you.
No, thank you.
Yeah. We look forward to seeing helping people.
Yes, absolutely. We look forward to being able to support people. So yeah, please do reach out if that's if you're in the space where that would be helpful. And if not, we hope that this session has been helpful. And as I say, it's absolutely not to scaremonger all of these things. There are things that can be put in place to support you and help you with that. And it's something we're really, really passionate about.
Yeah. So we look forward to seeing you. And tomorrow we're looking at navigating RSD in friendship. So tune in for that. But otherwise, thank you, Kara. And I hope to see you guys soon.
Thanks.
Bye.
Bye.